We're talking about tooth decay. The tooth has the enamel as the topmost part of it, and the enamel happens to be the hardest part of the body. So today we'll be talking about tooth decay, and I have in the house a dentist. He is Dr. Bimbo Oyedokun. Dr. Bimbo Oyedokun, you're welcome on the show.
Thank you. Good to be here.
Okay, so let's go. Tooth decay. What exactly is tooth decay?
Okay, so tooth decay really has a simple definition, which is when you have destruction of parts of your tooth, usually from the action of bacteria. So tooth decay requires certain things to happen. There are certain things that need to exist for tooth decay to come about. Everybody knows about the consequences of tooth decay, or at least we have an idea of tooth decay, but it's important to talk about what happens before you get to the parts that everybody talks about. So to start with, for tooth decay to happen, there are some things that must exist. First, you need to have the tooth itself. So you can't have tooth decay without the tooth. So first, you have the tooth itself. Now, the tooth normally exists in an environment in the mouth which has a lot of saliva, which also has a lot of bacteria. You have more than 500 bacteria that are naturally present in your mouth. Now, one of the key things we do with our mouth is to eat food. And you have something called dental plaque, which forms in the mouth from saliva, bacteria, which are found in your mouth, and some of the food substances you eat. Now, plaque is a sticky substance. It's like a film. You can't really see it. It's not easy to see, which forms over your teeth after you eat. And if the plaque is not cleaned off, the bacteria in it start to break down the sugar in the food which you've eaten and start to produce an acid.
Now, I know a lot of people like to use all sorts in their mouth. Like some people go as low as using broomstick to pick their teeth. And I hear about flossing.
There are many things you can do to prevent tooth decay. One is to watch your diet. So reduce the amount of sweet, sticky things you eat, or eat them shortly after meal times, and then rinse your mouth afterwards. The other thing you can do, apart from diet, is regular removal of plaque from your teeth.
When you have, a tooth decay already, how do you treat?
Okay, so treatment is going to be done by your dentist. This is one of the important reasons why we advise that you should see your dentist every 6 months, because treatment of tooth decay is always easier and better when it is caught early. That means that if you went in for a routine checkup and your dentist found a spot of tooth decay, or dental caries as we call it, that is just beginning, or that's called incipient caries, then sometimes all they need to do is probably just apply fluoride to it, and then ask you to come back in another week or two to see if the decay process has been arrested, and then the tooth is remineralizing. Now, however, when you have a hole that has gone beyond that, then the dentist will do things. First of all, once the hole is beyond the surface, obviously, to your dentist, then your dentist will probably want to take a dental x-ray to see the extent, and then they'll plan something called a filling.
Yeah, Dr. Bimbo, good to have you on the show today. Yeah, that's it on today's edition of The Doctor's Perspective, and we join Dr. Margaret on the other side of the program. Until then, see you next week. Bye.